I've been getting a lot more coronavirus questions from you guys lately, so I figured I'd go ahead and take a quick second to answer some of the more common and interesting ones you guys have asked. So by far the most common question that I get asked is, are we overreacting, and do we really need to be taking all of these extreme measures? And I think that the easiest way to address this is to think of it in the context of disease and healthcare treatment. So the coronavirus right now, and the disease COVID-19, are really causing two extreme dangers. The first is the disease itself. So about 3% of those who are getting infected with it are dying, and those who are at risk are mostly in the elderly populations and those with pre-existing health conditions, such as diabetes, heart disease, and lung disease. But outside of just getting sick with coronavirus, the other danger is that with all of these new sick people is that it could overwhelm our healthcare system. I think what a lot of us seem to forget is that hospitals aren't just normally sitting there empty waiting for sick patients to come in, right? There are lots of sick people every day in this world who are sitting in our hospitals being treated, needing doctors, medication, and bed spaces for things other than coronavirus. What happens when those hospitals who are already, let's say, 80% full, are now seeing a huge influx of new coronavirus patients is that they don't have enough resources in order to treat everybody. And now you're competing with resources to treat those who are already sick versus those new patients who are sick with coronaviruses. So what happens when there's too many patients and not enough doctors and resources to take care of them? More people die. People who weren't even sick with COVID-19 may not be able to get access to the hospitals now, which means that there's going to be more deaths than there would be just from COVID-19 infections alone. And that's what we're worried about, is overwhelming our hospital systems, which is why it's so important to slow the spread of this coronavirus and reduce the number of people who are getting sick from it and needing to go and take up hospital space. The cool thing about this is that you don't have to be a scientist, a doctor, or a soldier in order to fight this virus. By washing your hands, keeping yourself healthy, and temporarily distancing yourself from others, you have the ability to slow down the spread of this virus, which effectively means that you have the ability to save the lives of potentially thousands of people. The fate of this virus is literally in our hands. The second most common question I've been getting is, should I be panicking? Is it really all that dangerous? To which my answer is no, you shouldn't be panicking. At times like these, overreacting can be just as dangerous as underreacting. What is important is to know what you can and cannot do and what actions you should be taking. So things that you can do include washing your hands and limiting your close contact interactions for the next few weeks, staying home if you're sick, you should always be doing that, and you don't have to panic buy all of the groceries, because just like hospital beds, if you're using up all the resources, that means that there's other families out there who are suffering because they don't have access to them.